Hello, I'm Ariela Rabinovich, and today I will be talking about major depression disorder. I would like to introduce the topic with this quote, which reads as follows. I tell people it's like being dead. It feels like being a ghost, maybe. You float through your days feeling unsubstantial, cut off from warmth, light, and all feeling. Sometimes it feels like you're in a coffin buried alive. You're screaming inside your head, but no one can hear you. This reflection probably leaves you thinking about the purpose that you have in life, so in this presentation I will share with you what the disorder is all about. I will start by sharing a brief history about major depression and then move on to some of the possible causes, symptoms, and treatments that this disorder has. To begin, I believe that it is important to understand how major depression was discovered and how its perception has changed throughout various generations. The first historical writings that discuss depression described it as a spiritual condition. Like other mental illnesses, it was believed to be caused by demonic possession. The idea of depression being caused by demons and evil spirits has existed in many cultures, including those of ancient Greeks, Romans, Babylonians, Chinese, and Egyptians. Because of this belief, it was often treated with methods such as beating, physical restraint, and starvation in an attempt to drive the demons out. During the 18th and 19th centuries, also called the Age of Enlightenment, depression came to be viewed as a weakness in temperament that was inherited and could not be changed. The result of those beliefs was that people with this condition should be shunned or locked up. During the late 19th and early 20th centuries, treatments for severe depressions were not enough to help patients, leading to many people to look for reliefs and have lobotomies, which are surgeries to destroy the frontal portion of the brain. These surgeries were thought to have a calming effect. Unfortunately, lobotomies often cause personality changes, a loss of decision-making, poor judgment, and sometimes they even led to a patient's death. According to Jonathan Rotherberg, professor of psychology at the University of South Florida, major depression disorder today is characterized by a mood disorder that causes a persistent feeling of sadness and loss of interest. It affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. The most common include trouble doing normal day-to-day activities and the feeling of desperation that roots from the common belief that life isn't worth living. Even though the causes of the disease vary, I will mention ones that are believed to be the most influential. For example, brain chemistry. A recent research indicates that changes in the function and effect of neurotransmitters and how they interact with neural circuits involved in maintaining mood stability may play a significant role in depression and its treatment. Hormones can change in result to pregnancy, and during the weeks of or months after delivery and from thyroid problems, menopause, or a number of other conditions which are known to lead to major depression. It is believed that depression is more common in people whose blood relatives also have these conditions. Researchers are trying to find genes that may be involved in causing depression. Also, alcohol or drug abuse, certain medical conditions such as cancer of hypothyroidism, which can cause a person to feel distressed, and particular types of medications, including steroids that alter all the natural parts of the human body, are also known to cause major depression. Major depression is one of the most common disorders in the United States because of the multiple factors that lead up to it. It is predicted that a high 18% of the United States adult population will be diagnosed with depression this year, and numbers are still on the rise due to the coronavirus pandemic. Symptoms vary across every individual, but most people who suffer from this condition have reported angry outbursts, which include irritability and frustration, or even small matters, loss of interest or pleasure in most or all normal activities such as sex, hobbies, or sports, sleep disturbances, including insomnia or sleeping too much, tiredness and lack of energy, so even small tasks take extra effort, reduced appetite and weight loss, or actually increased cravings for food and weight gain. Anxiety, which is characterized by agitation or restlessness, slow thinking, speaking, or body movements, feelings of worthlessness or guilt, fixating on past failures or self-blame, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurring thoughts of death, suicidal thoughts, suicide attempts, or actual suicide, and an unexplained physical problem such as back pain or headache, which is very uncharacteristic for this type of disorder. Untreated major depression can have negative effects on the human body. Apart from the general symptoms that I explained before, a person may have constricted blood vessels, a higher risk of a heart attack, pain sensitivity, and a weakened immune system, amongst others. Even though treatment for each specific patient is different, The most effective solutions include medications such as selective serotonin reuptake inhibitors, also known as SSRIs, which are antidepressants that work by helping inhibit the breakdown of serotonin in the brain, resulting in higher amounts of this neurotransmitter. Serotonin is a brain chemical that is believed to be responsible for mood. People with major depressive disorder often have low levels of serotonin. This type of medication can relieve the symptoms by increasing the levels of serotonin available in the brain. Other medications include tricyclic antidepressants and medications known as atypical antidepressants that are used when other drugs haven't helped. They can cause several side effects, including weight gain and sleepiness, which is why they're not very commonly used. Psychotherapy can be an effective treatment for people with major depressive disorder. It involves meeting with a therapist on a regular basis to talk about your condition and related issues. It can help patients adjust to a crisis or other stressful events, replace negative beliefs and behaviors with positive and healthy ones, improve the communication skills, find better ways to cope with challenges and solve problems, increasing self-esteem, and regaining a sense of satisfaction and control. In addition to taking medications and participating in therapy, you can help improve major depressive disorder symptoms by making changes to your daily habits. This includes eating right, which for this disorder includes eating a high amount of omega-3 acids such as salmon. It's also beneficial for patients to avoid alcohol as it's a nervous system depressant that can make symptoms actually worse. Also, restraining from certain refined processed and deep-fried foods are beneficial for patients getting treatment. Getting plenty of exercise is recommended for major depressive disorder patients as it is an stimulant and can actually help boost the mood and make persons feel better. Finally, sleeping well is one of the best treatments for not just major depressive disorder, but a lot of types of disorder, as it is vital to get at least 6 to 8 hours of sleep for successful activity levels. Finally, hospital and residential treatment are the final step that psychologists choose to take for patients who suffer from the major depressive symptom. This is a partial hospitalization or day treatment that can help some people actually get encouraged by talking to others and having communications with the outside world.